Hi, thanks for watching today. I'm Joya Vanderlaan. I'm a family nurse practitioner, and I specialize in functional and integrative medicine, and even more sort of specifically, I specialize in hormone optimization therapy for men and for women. Today we're going to be talking about women though. And what I want to go over is menopausal, perimenopausal, especially signs and symptoms. These are so often missed, not only by the patients, although they're really not missed by the patients. They're really missed by the gynecologists and so on that are not kind of updated on the most recent and valid and true research. So if you're having symptoms of perimenopause or menopause and you're kind of getting ignored or pushed off by your doctor, please find somebody who will help you. You can look at our website, nourishhousecalls.com, for some help with that. And there are, of course, many other people who are trained and willing and, expert at helping. So managing hormonal symptoms and perimenopause, menopause is not just a matter of making sure that you feel well now. It's actually a really important piece of making sure we preserve your health into the future and prevent diseases like osteoporosis, bone loss, heart disease, dementia, and other kind of brain-related symptoms, let alone the risk for certain types of cancer. So we really want to make sure that we're paying attention to these symptoms as they are a sign of hormone imbalance. We don't want things to be imbalanced or too low or too high in our bodies. It's just not healthy. So a quick sort of definition, I suppose, for those of you who may not be as familiar. We often hear about menopause, but we don't as often hear about perimenopause, peri meaning the time around. So menopause is a day and time, and that day is 1 year from your last period, usually happening at an average of around 50 years old or so. Perimenopause, though, can start an average about 10 years ahead of that. So when you are in your early to mid 40s, you are absolutely likely to experience symptoms of perimenopause. So what are some common symptoms of this perimenopause that we're talking about? Well, often I get women into my office, and when I go into their homes, I do house calls, telling me they're having hot flashes, or not even hot flashes, but just temperature dysregulation. They're having sometimes digestive issues. They're having brain fog and weight gain, especially around the middle. They're irritable. Their libido is low. They're having vaginal dryness. They're having maybe some lightheadedness, even some memory issues. Even muscle and joint aches and pains can be associated with this time of perimenopause. Irregular periods, certainly heavier periods, more clotting in the periods. All of these can be signs, symptoms of perimenopause, and we're not taught to recognize it. So I'm telling you now, recognize it so that you can treat it. Some lesser known symptoms too are urinary symptoms, so increase in urinary tract infections, sometimes heart palpitations, feeling like your heart is racing, and then for sure a decrease in libido, which let me tell you is a big problem for women and men who are going through hormone changes, but especially if you don't understand why, it can be really disconcerting that all of a sudden you don't have this desire for your husband or for your partner. Okay, so now that I've told you all of the hairy, scary symptoms of perimenopause, what can you do about it? So I'll tell you my approach, and it's a good approach. I'm helping hundreds of women doing it the way that I'm doing it. We want to test. After listening to the symptoms and determining really what is this likely to be, we can determine appropriate testing. I love to test the hormones with the Dutch test because that is the most comprehensive, full way of looking at somebody's hormones: estrogens, progesterone, DHEA, testosterone, cortisol even throughout the day. And then a few organic acids to make sure that we're, looking more holistically. Then when we find out what is imbalanced or low or high, we intervene. And most commonly what that looks like for me is hormone replacement therapy, sometimes some adrenal support, although when your hormones are out of whack, your adrenals are stressed. And so oftentimes I find when we optimize the hormones, those adrenals, they get a bit of a break and they can recover more easily. I also want to look at nutritional status and do some testing there, covered by insurance actually, this full nutritional panel looking at everything from your vitamins, nutrients, minerals, amino acids, omegas, even looking at your mitochondrial function, methylation function, All sorts of really great things to look at a patient comprehensively. Sometimes we'll do stool testing to figure out if anything's going on in the GI tract that's affecting your hormones or affecting your life in some other way or your health in some other way. So we want to have a full picture. We also want to look at lipids and inflammation and insulin resistance markers and ferritin and iron, all sorts of things. We do very comprehensive labs. Then we can treat that patient as a whole and recommend maybe some supplements, lifestyle changes, and then sometimes prescription bioidentical hormones. I will tell you there's a lot of people out there, non-prescribers usually, who are touting the benefits of herbal therapies for menopause management. I haven't seen that work so well, and I especially haven't seen it work so well, and the evidence doesn't show that it helps with things like the dementia, the bone loss, the heart disease, those symptoms of menopause and those effects of losing your estrogen. So truly, I do believe, and research shows, the best way to manage menopause, perimenopause, and beyond is hormone replacement therapy. It just has so many benefits. When your hormones are imbalanced, nothing in your body is going to work right because hormones are such universal and powerful signaling molecules that if they're off, nothing else is going to be working right. At Nourish House Calls, when we encounter patients like this, or any patients that we encounter actually, we always provide an individualized plan of care. And this is why appointments are nice and long, so we can listen and plan and individualize. We don't have protocols that I just say, oh, this is the menopause protocol, so you get slapped with this prescription or this supplement. No, it is always individualized, and it's a lot of work. But you know what? It works almost every time. I'm trying to think if there's any patients who haven't benefited from it. Anyways, it works so well for so many women. So I would encourage you to find somebody. That might be us. We're licensed in a bunch of states. You can check it out on our website, nourishhousecalls.com, where we're all licensed. I'm in Illinois physically, and I do house calls within about a 10-mile radius of where we are, close to Westmont, Hinsdale area. But you can book a discovery call online and kind of discover how do we do these things and what would it be like to receive care with us and what our costs are on our website too. You can check that out. But give us a call. We can book a discovery call with you and kind of go over some of those options. We look forward to helping you.